Welcome back to Houston Newsmakers. I'm joined by Dr. Tim Garson, the Director of Health Policy Institute, the Texas Medical Center. Among his many previous positions, Dean of the University of Virginia School of Medicine, Chief of Pediatric Cardiology at Texas Children's Hospital, many other lofty, impressive positions in medical world that would take about 10 minutes to talk about. So we won't do all of that. What we will talk about is the premise of this book that you have, which is entitled Exposing the 20 Medical Myths. What led you to write this book?
So go back several years, and I happened to notice in the 2008 election that all three of the candidates said if they could just make preventive care work for everybody, they could pay for the uninsured. And I had, among some things, gotten a degree in public health, and I said, no, that doesn't work that way. And so I started to look into it, and that became one of the myths. Preventive care doesn't save money. Now, 43 times, if I can say it quickly, preventive care is really important. So not that it's bad, it's the right thing to do. But if you think about it, and you'll get this in a minute, some preventive care surely saves money. If you are a company and your employees have flu shots, saves money for the employer. Got that. But there was a marvelously done paper back a long time ago where the government, where the CBO looked at what would happen if they increased the price of cigarettes 50 cents, okay? 50 cents a pack. What would happen 30 years later? Okay, so they go through all the stuff, and you'll get this in a minute. So cigarette price goes up, smokers go down, they live longer, they're more expensive. So that money is not there to pay for the uninsured, is the point. And that became one of the myths.
And one of the things that happened is it always becomes a political football when people talk about different things. It was repeal and replace, which was a phrase coined by Republicans, as they did about Obamacare, which Mr. Obama embraced. But then we have now in the debates now, the Democratic candidates are debating, and you hear the conversation about Medicare for all.
Yes.
And something Senator Elizabeth Warren says, okay, this is what we want to do. Some of her opponents say, well, she's not really forthcoming with how much it's going to cost. When you hear that sort of thing, what about Medicare for all? Should people know about it if they're going to evaluate whether it's a pro or a con?
So in the book, 2 chapters deal with that, so you can go take a look. Here's your very own copy. Medicare for all, if you took a step back and said, health care for everybody, terrific. Right? If you just stop there, and I think what's happened with Medicare for all is that people have slipped into using that without necessarily walking through how much it costs and what that means. Example, one of the candidates has said, if we have Medicare for all, everybody gets everything they want, every doctor, and the price is less, okay? No. And then that particular candidate says, and that's true in every other country in the world. Well, no. Every other country in the world has a private system. Every other country, including Canada. People say, oh, no. Canada has a private system, and in fact, 1/3 of Canadian costs are in the private system because they don't cover prescription drugs in the public system. So everybody has a private system. And so one of the things we talk about in the book is maybe call this a single safety net, where everybody has health care, just like public school, okay? And then you can buy into, quotes, private school. And if you want to buy private school and have commercial insurance, you can do that.
Of course, right now, of course, everybody is running in the primary. They want to get those folks who are really rabid, either left or right, to say, yeah, Medicare for all, this is what I want. They need to read your book and get more details out of that. One other myth in your book, the United States health care is the best in the world. You say that is a myth. Say it ain't so, Doc.
Okay, let's start with what's healthcare and what's health. Okay, so first thing, got to figure out How are you going to define that? Well, it turns out you can define health as life expectancy and infant mortality. That works, right? So, life expectancy, we're about 50th in the world. Infant mortality, we're about 50th in the world. So that's called the 50-50 club. And so with respect to health care, not so good. Now, you then, really, really interesting, and we've referenced pretty much everything in this book, but it's all at the end if you don't want to read those. There's a paper that talks about, well, what goes into life expectancy? 40% is what we do to ourselves. So 40% of life expectancy is smoking, drinking, accidents, murders. I was blown away, not a good way to put it, by the fact that in the US, a teenager has an 85 times the chance of being shot dead in the US than in Britain. 85 times. And so the answer is we sort of think of life expectancy as heart attacks and all that. No. 40% is the stuff we do to ourselves.
It's clear to me that there's just so much more that goes into, quote, health care and caring about ourselves than just going to the doctor. I'm going to put this up so we can get a shot of this, but over the next weeks or so, I want people to go ahead and pick this up. What do you want people to get out of this? When they see this in the bookstore and they can get it up or get it online or whatever, what do you want them to take away from this?
So, what we would love is simply they get educated, simply they get it. And so when somebody would say Medicare for all, they would get what that means. Somebody would say public option, they'd get what that means. The idea that the US costs twice as much as the average price in any other country, why is that? And so why is that important to the general public? Because we waste, Chapter 3, we waste $1 trillion a year in medical care. $1 trillion a year. 1/3 of everything we spend, we waste. Wow. And so what can happen is to figure out how to address that waste. And the public, not a surprise, some of people going to the ER when they don't need to be in the ER. Right. Those kinds of things, they can actually help reduce the price of health care, which we have to do, whether it's Medicare for all or public option or more Obamacare. We gotta reduce the price of health care.
Well, this book is gonna help in that process. I think if those of you who know about me, about this program, we want to try to get you in a position where you can be better informed about decisions you make. This is gonna help doing that. Doc, thank you so much.
Great, thanks.
20 medical myths, exposing the 20 medical myths, why everything you know about health care is wrong and how to make it right. Good luck with that book.